Hello all. Today in this class we are going to discuss about connectors in prosthodontics. That is, in removable partial denture we are having different types of connectors, and the major one is called major connector, and the other one which connects other parts to the major connector are known as minor connectors. So today we are going to deal with major connectors. These are the different types of major connectors which we use for our patients. So first, let's see what are the different components of removable partial denture. They include major connector, minor connector, direct retainer, indirect retainer, receipt, denture base. Then also we have artificial teeth. So once again, these are the components, that is major connector, minor connector, direct retainer, indirect retainer, receipt, denture base, as well as the artificial teeth which is being attached onto the framework. So what is the major connector? It is that part of a partial denture that connects the part of the prosthesis located on one side of the arch to the parts on the opposite side. So it is nothing but it is a part of the partial denture that connects the parts of the prosthesis located on one side of the arch. That means on one side of our edentulous ridge to the other side. Okay. So the major connectors are again divided into maxillary and mandibular. Maxillary is for the upper jaw and mandibular for the lower jaw. So let's see what are the requirements for the major connector. So the first requirement is that it must be rigid. That is, it is going to allow distribution of stresses over the abutment tooth and underlying bone and soft tissue. It must avoid impingement on free gingival margin. The marginal gingiva is susceptible to injury, so we are supposed to avoid impingement of the free gingival margin. So the maxilla, the arch border must be kept 6 millimeters away from the margin, and in the mandibular arch it should be kept at least 3 millimeters away from the free gingival margin. Then the next requirement is that the border should run parallel to the gingival margin of the teeth. If it crosses the gingival margin, it should be at right angles to the margin. Okay, so the borders should run parallel to the gingival margin, and if it is supposed to cross the gingival margin, it is to cross at an angle of 90 degrees. So whenever it crosses the margin, a relief must be provided between the metal and the soft tissue. So keep in mind that whenever the major connector has to cross the margin or the minor connector has to cross the margin, it has to have a relief under that. Okay. So it must not create food entrapment in the areas. Always we have to keep in mind that there is every chance for food to go in between the prosthesis as well as the soft tissue. So it must provide an area which is not creating any chance for food entrapment, and it should maintain comfort always. Whenever we give a prosthesis to the patient, it has to maintain full comfort for the patient. So this is it. The major connector has to be kept away from the gingival margin as much possible so that the impingement on the soft tissue is avoided. So what are the different types of maxillary major connectors? We have single posterior palatal bar, palatal strap, anteroposterior palatal bar, horseshoe shaped connector, anteroposterior palatal strap, and complete palate. So in that, the first one we are going to discuss again, it is the single palatal bar. It is a narrow half oval bar which is thickest portion at its center. So a single palatal bar is a narrow half oval bar with its thickest point at the center. See, in the diagram we can see the only indication is for interim partial denture. Basically, it is used only in case we want to keep a interim partial denture for the patient. So the next one is palatal bar. On the disadvantages is that it is bulky, little vertical support from the bony palate, and it cannot be placed no further anteriorly than the second premolar, and it cannot be used in distal extension situations. So here we are going to see about palatal strap. It is the most versatile maxillary major connector, and it should not be less than 8 millimeter wide. Width increases as edentulous space increases. So this is the diagram of palatal strap. Okay, so this palatal strap type of a partial denture, and the advantages are it offers greater resistance to binding and twisting forces since it is located in three planes, and it is thin, hence it is more comfortable to the patient. So it offers greater resistance to bending and twisting because it is a wider one and it is a thinner one, so it is more comfortable for the patient. And the disadvantage is that there will be adverse soft tissue reaction in the form of papillary hyperplasia beneath the palatal plate if it is impinging much onto the soft tissues. Okay, so next is posterior palatal bar. It consists of flat anterior band and half oval posterior band, and the two bars are joined together by longitudinal elements. This configuration gives good rigidity, and the greatest advantage is the anteroposterior palatal bar. So this is the diagram. See the appliance or the processes. This is how it is fabricated. Okay. So the advantages of anteroposterior palatal bar is that it is having good rigidity, and in case of large inoperable tori in the palate, we can make a anteroposterior palatal bar without causing any damage or any interference with the maxillary tori. And the disadvantage is that it is uncomfortable and it provides only little support. It is contraindicated if the abutment teeth are periodontally weak. So next is anteroposterior palatal strap. It consists of a thin band of metal running along the lingual surface of the posterior teeth and extending onto the palatal tissues. So anteriorly, the metal normally covers the cingulum of the present teeth and extends into the palate to cover the entire root area. The borders of the connector is either 6 millimeter from the gingival margin. Okay, so this is the U-shaped major connector, maxillary major connector. Okay, see the diagram. It is basically in the shape of a horseshoe. Okay, and the horseshoe shaped connector, the advantages are it is used when several anterior teeth has to be replaced, and it is designed to avoid prominences. The disadvantage is it has a tendency to flex or deform when a load is placed. Hence, it is a poor choice for distal extension situations. Then we have anteroposterior palatal strap. It consists of an anterior and posterior strap with an opening in the palatal area of at least 20 into 15 millimeter of space in between the two straps. Each strap should be at least 8 millimeter in width and relatively thin. So this is the anteroposterior palatal strap. See the diagram. It is having a thickness of 8 millimeter in width then it is 6 millimeter away from the free gingival margin. Okay. So the advantages are it provides good support because of its corrugated shape. It adds strength with less thickness. Disadvantage is that the anterior strap is extended onto the rugae interfere with the speech. Complete palate, a major connector that covers the entire palate. This is the another type of major connector that covers the entire palate, almost like a acrylic RPD. The anterior border must be kept 6 millimeter from the marginal gingiva or extended up to the scingula of the anterior teeth. So this is the diagram of the complete palate type of a major connector. So the advantage, provide ultimate rigidity and support. It is used when remaining teeth are periodontally involved. All metal coverage enhances the thermal conductivity. So these are the advantages of the complete palate type of a major connector. As it is having more length and more material, it provides much rigidity as well as support for the prosthesis. It is used when the remaining teeth are periodontally involved, so it automatically provides a support for the periodontally weakened teeth. Then the all metal coverage enhances the thermal conductivity so that the patient can appreciate the temperature variations of the food which they consume compared to the acrylic type of a partial denture. Disadvantage, adverse soft tissue reactions may occur in the form of papillary hyperplasia and occasional problems with phonetics. So this case indicated in weak periodontal support, adequate periodontal support, the palatal strap or AP palatal strap, the type of major connector, long span distal extension, anteroposterior palatal strap or complete palate, anterior teeth to be replaced, anteroposterior palatal strap is indicated, and in case of a palatal torus, anteroposterior palatal strap or anteroposterior palatal bar connector is indicated. Okay, now we want to do an exercise like identify the type of major connector. So what is the type of major connector used here? What is the type of major connector used here? What is the type of major connector used here? What is the type of major connector used here? And what is the type of major connector used here? Okay, these are the different types of major connectors which we have discussed. And the first one is anteroposterior palatal bar, then we have the complete palate, then we have the horseshoe shaped one, then we have the anteroposterior palatal straps, then palatal strap, then anteroposterior palatal bar. Okay, so we have done with that portion. So whenever we want to place a partial denture in the patient's mouth, we are supposed to take a decision about the type of prosthesis which we want to place in the patient's mouth. So, in such situations, we have to look into the situations which are present in the oral cavity of the patient. So, if we are having few teeth remaining in the oral cavity, we have to provide a partial denture which provides its support through the remaining teeth, and it provides better comfort to the patient. Comfort in the sense it has to be with minimum thickness, it has to enable in proper aesthetics so that the metal parts should not be visible to the onlooker, and it has to be comfortable to the patient, and it should provide the temperature variations felt by the patient, and it has to have a condition in which it is not going to harm the remaining tissues or cause any papillary hyperplasia or inflammation or recession which is or which may can happen with this type of prosthesis. So always we have to make a diagnostic cast, look into it, do a proper surveying of the cast, and find out which all areas we can use and which all areas we can eliminate from the situation. So in such situations, we have to do a proper surveying of the cast, and we have to do the proper mouth preparation, which includes the placement of guiding planes, the placement of the occlusal rest, and things like that. After that, we have to decide upon the types of major connector which we are going to place. So depending upon the need of the situation, each and every situation varies. That is why we are having different types of connectors available for us to choose. Okay, so we have to choose a major connector which is suitable depending upon the type of situation which we are having with us. So after deciding upon the type of major connector, we have to decide upon the different components which we want to keep, or which we are going to keep as attachments, so that it will provide a better, comfortable processes which will enable the patient to do all the functions, including mastication, phonation, aesthetics, and everything, so that the patient can use it as a comfortable processes for a longer period of time. So, thank you. Thank you very much for your patient listening.